Initial remarks are being made in Basque.
Oso garrantzitsua da, voluntarioetzatik lan egiten dugunontzat, esfortzu asko dagoelako proiektu guztien atzetik, eta holako errekonozimendu bat asko suposatzen duelako proiektu honen atzean lan egiten ari diren pertsona nagusi guztientzat. Eta hori esan da, noa pizka bat azaltzera, zer dan ilarrezko aria proiektua, proiektu zar bat delako, baina egokitu egin behar izan dugu urtengo egoerara.
What I was saying in Basque now is thank you very much for allowing me to present this project called Hilo de Plata, or Silver Thread. And it's a recognition that is very important for all of the people that are working, the volunteers that are working in this project, because they are making a significant effort, and that involves many hours of work in solidarity with senior citizens that are in difficult circumstances or situations. But firstly, I would like to explain what this project is all about. It's from Nagusilan. This was born 25 years ago, in particular in San Sebastian, and it was produced by a number of people that knew about the volunteer experiences in the United States of retired people there. And they brought their experiences here to assist elderly people that were living alone. So they saw that there were many people in this situation, and they started to develop volunteer activities of different kinds in different fields, because they started to provide support at nursing homes on an individual basis, and they also did this at day centers and at homes. And in this task and in this support at home, you can see that it's not always easy. It's not as easy as saying, okay, well, let's provide support for people at home, because they came across a reality, and that is that many of the people that are living alone are living in the rural areas where sometimes it's not easy to get there. And there are lots of people that are living alone in dwellings that are hardly accessible. And there is also a reluctance, or there's a difficulty sometimes of opening up our door, our space, which is our private space. So opening your door to somebody that's unknown or somebody that is new is not that easy. So what they did was design a new project that is called Hilo de Plata, or Silver Thread. But how could we overcome these difficulties? And what they did was devise support via telephones. In other words, with the telephone, you can reach out to many more people. You can also reach out to many more homes and more rural areas. And in other words, take a shortcut as regards accessing lots of homes. And what they did was set up a 900 line, telephone line, for all the people, elderly people that feel that are alone can call in. But how was this organized at the beginning? This was born in the year 2000, so it's been around for 20 years. And, well, what they did was we did this at the Nagusilan premises, where the call center was set up. And, well, people discovered it, and people started to call in to have a chat. And the goal was, well, those issues or those conversations that could be held that we have with our friends or with our family, or those people that do not have friends or family, so that they can speak to somebody, and to supplement other psychological support services or meet other needs. And also with a certain amount of specificity, in other words, so that, well, they don't only call in, but we call them. And once they access the service, they are allocated a volunteer, and they always speak to the same volunteer. And it's the volunteer that calls them up in a certain time frame during the week. And let's say that they do is set up a relationship, and it's not only about volunteer activity, so they get to know each other and they start to create other kinds of links. So 2020 came along with COVID, and all of a sudden Nagusilan came across a twofold challenge. the challenge of what's going to happen to these people that are living alone at this moment of lockdown. Before, if they were living alone, and now with the lockdown, the feeling of being lonely became even worse because they have less possibilities of going out. And those people that perhaps did not have that feeling of being so alone because they had their routines when they went outside to go to the supermarket or go and see their family doctor, whatever, they suddenly were locked down too, and they started to feel lonely. So in other words, the feeling of loneliness grew exponentially among senior citizens, especially those that don't have a social or family network and whose everyday life is related to their daily routine that is completely upset or disturbed. And apart from the concern we had for these people, we had a concern about our volunteers because they are also senior citizens and they are equally vulnerable to the pandemic. So we have loads of volunteers that are used to carrying out these activities and in providing home support. So we thought about this and we thought, okay, well, we have a resource that is perfectly adapted to the situation, which is to provide telephone support. But how can we adapt this technically to this situation and activate all of these volunteers that are willing to do something so that they can get in touch with these other senior citizens that feel lonely and that need to have some kind of support that many times is only about talking to somebody for a while and filling up those long hours in the afternoon that have been very boring for everybody. But if you don't have family support, it's even worse. It's even worse, rather. So what we did very quickly, we said, okay, what shall we do, or how can we do this? Well, we had to overcome a technical issue that was relevant, and that is the method we used in the past of having a telephone exchange of receiving and making calls was of no use because everybody was at home. So what we did is see technically how this could be done so that these volunteers could call in to the people that needed them and well, with the issue of data protection and confidentiality too, so it wasn't a straightforward issue. But at the end of the day, we did find a solution to place hidden calls and be able to reach out to all of these volunteers. And we also adapted the issue of training because lots of volunteers had already received training and they had previous experience in accompanying or supporting. But many new people wanted to provide this support, but they had to be trained first. And orientations had to be given, so how they were supposed to make those calls technically and for the whole thing to be effective. And then what is essential is to coordinate ourselves with other services because we saw that it was absolutely complementary to other services and that we had to coordinate everybody to meet everybody's needs. And we were there to accompany people that were living on their own, and there are other services to provide coverage of basic requirements like food, for instance. And then one of the most complicated things was to reach out to those people that felt they were alone. Because in this collective of senior citizens, the people that were loneliest were those that were less involved in the networks, or those people that connected less to the internet. So we had to reach out to them through traditional channels, more traditional channels. So we then carried out a campaign, and first of all, we did it with professionals with other resources that were accompanying elderly people in other areas by the issue of food or cleaning or whatever. And then, well, the traditional systems like the radio or the press, and we knew that they could reach out to these people that were living in a more isolated manner. So we joined the Laguna Artea network, and what we did, well, many people were calling in, and we said, okay, well, look, if you have this need, let's join Gustion Artean so that the Red Cross can give us a helping hand. Because if you need psychological help, apart from conversation, we had the Association of Psychologists also involved. And another of the most important things of this project is that it be the volunteers themselves that became involved and said, okay, well, if we want to do something, we have to make it technical feasible. We don't want to stay at home. We know that we are old people, that we are vulnerable. We know that we cannot do certain volunteer activities in person because that poses a risk for us, but we want to do something from home because we are okay and because we also need to play an active role in terms of collaborating with these people and in developing solidarity to cope with this virus. And then we have calls from other bodies and other communities that were very important too when the time came to disseminate what we were doing. And then the issue of making ourselves known, the volunteers participated in this. And another positive action that was generated was the high degree of solidarity. And we were not only called up by people to have a conversation, but we were called up by many other people to offer themselves as volunteers and companies offering their staff so that they could also make telephone calls, and professionals from the field of psychology. So we couldn't involve everybody, all of those people that were willing to call these elderly people that were living alone at home just to have a pleasant conversation with them. And, well, we activated the Nagusilan volunteer movement, and then little by little we incorporated more people from other spheres. So in-person training became online training through presentations, and we gave them some training materials. And then another of the issues that was very important was to extend how these people could access the system. Before we had the 900 line, telephone line, and we set up other pathways like WhatsApp and email. And the ultimate goal was that it be very easy to access through as many channels as possible, and that nobody be left outside. The goal, well, we wanted to support elderly people that were living alone through telephone conversations, but we also wanted to activate these senior citizens that wanted to become volunteers to provide support and feel useful in this solidarity network that was set up. So another of the important things was networking. And without networking, it wouldn't have been possible to give support to so many people. And that is the work with the social services or with the health care services. And it was through the telephone calls that they managed to identify what kinds of needs senior citizens had, and how you could see that many of the senior citizens that were calling in needed to speak to somebody. They needed to hold a conversation and tell them what kind of experience they were having and what they were feeling. And the number of calls placed were, when it was nearly 5,500, it was 63 volunteers that were in charge of the telephone from Monday to Sunday, calling people up and holding all sorts of conversations with them. So each person spoke about whatever they felt like speaking, and it was more than 12,000 hours of volunteer work. In the case of the people that participated in this exercise. And then goals achieved. Well, it's been very important to demonstrate that we have been able to say, look, we have to give a quick response. This is required by the situation, and by organizing ourselves properly, we've been able to meet a need that our volunteers and our assisted people had, because we set up WhatsApp groups to give support to our volunteers who were equally old people, and they were under lockdown, and they felt alone too because they'd stopped doing their daily activities because of the lockdown. So networking has been extremely important, and we've demonstrated to ourselves that we can operate in different sectors together, and that this coordination produces some excellent results. And it's been more than 24 social services and the volunteer agencies, foundations, healthcare centers, companies. And thanks to the volunteers, there was a very big impact. And, well, nearly 550 applications were received in 3 months. This is the new image that Hilo de Plata is going to have, and with the new system, what we're going to do is extend it. So this is what the situation has brought about, and that is a new organization for the project, which we wanted to reach out to many more people. And then evaluation. Well, it's been very important because we carried out an evaluation in summer on the people that we've given support through the program, and there was a very high degree of satisfaction. And, well, the outcomes have shown that many of the people that we started to give support to during the lockdown and stayed with the project. They want to continue with these conversations. And then as far as the volunteers are concerned, in the workshops we held, well, the most important thing, what they found was most important, or what they underscored, is the feeling of being useful and of doing away with that stigma of being older people. No, but they've been able to achieve their objectives and to remain active through telephone calls. And very quickly now, just to finish off, there's been a very significant social impact, and it's a project that is very straightforward, but we believe that it's definitely worth it, that it can provide plenty of support to many people. And that's it from me. Thank you very much. End of the presentation.
Eskerrik asko Enara baita zuri ere zilarrezko aria programaren nondik norakoak azaltzeagatik. Ez duk aipatzen duzun bezala gainera oso garrantzitsua da ikustea nola bueno, osea, bi aldetatik datorrela elkartasuna, ez bakarrik.
Comments are now being made in Basque again, so we'll have to wait until they say this in Spanish.
Ikusten diotelako animoak ematen dituztenek ere.
Batez ere, beraiek aipatu dutena, ez? Azkenean, etxean egotea eta ikustea ezin dutela hasier egin, beraientzat oso gogorra izan da. Batez ere, ohitura, boluntariotza lanetan ibiltzen ohitura daukaten pertsona horientzat. Beraz, satisfazioa beraientzat izan da itzela, eta horretan jarraitu nahi dute. Azkenean, nagusia dira eta asko daukate erakusteko eta egiteko gizarte honetan. Batez ere, beste batzuei laguntzen.
Hablamos de la importancia o del valor.
We're talking about the importance of this program. It doesn't only benefit the people that receive the telephone call, but also the people that offer this support. We are receiving congratulations from the people